A good next point is about reading about adventure therapy. Is adventure therapy its own thing, or is adventure therapy an adventure with talk therapy? This is contentious of a debate. Some people think, especially when we get into trauma, that the talking therapies are less important, that it's more about how somebody regulates their body in the outdoors, how they have a peak experience. If traumatic experiences can hurt people, can an amazing positive outdoor experience help people? I would say I float between both of them. But that said, what I do think is really important, and what has really hurt the public image of outdoor therapies, is it's very poorly defined. It's very poorly articulated. It's really hard to tell why should a government who's funding you to work outside give you money when your client can freely go outside whenever they want to. So those are sort of the issues. So it's really good, what I would say as a practice to do, is to write down exactly in the most detail what your perfect session will look like. So if you, one of the reasons it's good to have a talk therapy associated to your work is it gives you a framework for knowing where you're going, what you're doing, and how you're actually going to think about your client's experience. A good metaphor for this is if you go to a train station and you know you want to improve your client's well-being, and you know that every train, no matter what direction it heads, every train will take you to improved well-being. But if you can't articulate what train you're on, you'll never know when you're off track from where you're headed. So the reason it becomes important is it gives us the language of how our client is experiencing something. So if we have the trauma-informed language, we're going to really be thinking about the body, the physiology of what's going on. Is our client regulated, this and that? But what that means is we have to actually know how that's going to impact life outside of the session. And so you need a roadmap to figure that out. So as a solution-focused person, I'm thinking, what is my client taking away from our time together that will get them, that will give them hope for a better preferred future? The other thing I want is I want my session to be an absolute exception to the problem that brought them to therapy. So as someone who works with teenagers, if they struggle with patience, I want to see them make a fire on a wet day and by themselves. I don't want to prescribe this to them. I just want it to happen. And I want to watch for a narrative that's different to the problem. So we call this, in solution focused, a climate of competence, that the young person feels competent, that what they're doing during their adventure is a difference to how they feel in school. It's with substance use, this is a good example, having fun while sober, right? So if you have this session where the client has this boatload of fun outdoors, rock climbing while sober, they have the possibility to have fun sober in the future. You've created an exception to the problem. If we go back to the question about being directive or non-directive, the possibilities that come out when we're too directive, it means that we have our own lens attached to what should happen. So while it's important to have a framework, the framework should be focused on how the client experiences the service we're providing. So I think a future for adventure therapy is we have an adventure therapy book, right? Second edition comes out this year. It's really good. I personally cannot read that book and walk away going, now I know exactly what to do. The other thing is we say the word adventure therapy. Now, what Tanya does with that word adventure therapy compared to what Kyle does, compared to what Will does, there's no uniformity there, which is not a problem. It is beautiful to be diverse. It is amazing that this one word contains thousands and thousands of people around the world doing incredibly different work. What we need is people to be able to articulate clearly what it is they do and why they do it that way. And so that's where having theories and models and talk therapy theories attached to your work can be really helpful.